and welcome to EHI TV, eHealth Insider's essential news on video. Last week, the news was filled with long-awaited announcements about MP Fit. Now the news has had time to settle, most of our readers are still trying to get to grips with what it really means. Our number 3 most read news story this week is, of course, the news that the national programme was ended, at least in its current form. Last week, Health Minister Simon Burns announced that the programme would no longer continue under the MP Fit banner, with more decisions about IT being made locally and a greater choice of IT systems across the country. However, following that announcement, our number 2 most read news story provided some clarity on what that really meant, with Christine Connolly claiming that the LSP contracts will be honoured. What seemed to be a major breakthrough in the programme was soon questioned when Connolly said BT's contracts would remain unchanged and that CSC was still under negotiation, the outcome of which would of course depend on the success of Lorenzo at 4 early adopter sites. Now there's speculation as to whether Lorenzo will ever be called a success. So our number 1 most read news story this week details major problems at Morecambe Bay. The Trust has launched a stabilisation plan to try and get issues such as living patients showing as deceased in the system and additional staff being employed for data entry under control. Meanwhile, another early adopter site, NHS Bury, is yet to sign off Lorenzo, and Birmingham Women's, the next early adopter, has pushed back its go-live to an unspecified date. So despite the announcement, the future continues to feel uncertain. That's all we've got time for this week, but for a more in-depth analysis of the past week's developments, check our analyst view on MP Fit and our week-by-week coverage of Lorenzo at Morecambe Bay in our opinion and analysis section. I'll see you next week.